Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC exam preparation. Also, these questions will helpful for your RRB and other nursing officer exam preparation. In the previous video, we discussed questions from pharmacology, and here again same pharmacology questions we can see. And the first question, a pregnant woman in second trimester is suffering from UTI. What is the drug of choice for the treatment? So our question, a woman is in second trimester of pregnancy and suffering from UTI. UTI means urinary tract infection, and the drug of choice for this UTI is ampicillin. Option B is the correct answer. What is the next question? Bark of which plant yield famous drug of malaria? Options: option A Syngona, option B Butula, option C Eucalyptus, option D Quercus. Question: bark of which plant? Bark means is the protective outer covering of the branch or outer covering of the wood, that is bark. Bark of which plant is useful for the treatment of malaria? It is Syngona, option A. Move on to the next question. Antitussive drugs which inhibits. Options: option A cough, option B excessive tears, option C itching, option D sweating. Antitussives are drug which inhibit cough. Option A is the correct answer. And the second option, excessive tears. Excessive tears is known as epiphora, the one word. And itching. Itching, the drug which helps to relieve itching is known as antipruritics. And diaphoretics. Related, that option related point I am telling. Diaphoretics means drug which increases the action of sweat glands and induce perspiration. So perspiration inducing agent is known as diaphoretics. Perspiration or sweating. Move on to the next question. Test for hypersensitivity is called. Options: option A Patrick's test, option B patch test, option C tuberculin test, option D none of this. Test for hypersensitivity. Hypersensitivity means to check the allergic reaction. Test for allergy is patch test. Option B is the correct answer. And the next question, drug of choice for Crohn's disease is. Options: option A steroids, option B azathioprine, option C infliximab, option D tocolytics. Drug of choice for Crohn's disease. Crohn's disease means it is one of the inflammatory disease of the GI tract, especially it affects the terminal ileum. Here the drug of choice is the question, so it is infliximab. Option C is the correct answer. And the next question, which among the following is an example of prokinetic drug? Options: option A aramipril, option B ondansetron, option C metoclopramide, option D all of this. Among this, which is an example of prokinetic drug? Prokinetic drug means the drug which has the ability to stimulate the smooth muscles. Okay, among this, metoclopramide is an example of prokinetic drug. Option C is the correct answer. Metoclopramide is an example of antiemetics. Move on to the next question. Which among the following is a beta-lactam antibiotic? Options: option A erythromycin, option B cephalosporin, option C tetracycline, option D ciprofloxacin. Which is an example of beta-lactam antibiotics, and the correct answer is cephalosporin. Option B is the correct answer. Move on to the next question. Which among the following is a most effective broad spectrum oral antifungal agent? Options: option A meconazole, option B clotrimazole, option C ketoconazole, option D iconazole. Among this, which is an most effective broad spectrum oral antifungal agent? It is ketoconazole. Option C is the correct answer. Oral broad spectrum oral antifungal agent. Move on to the next question. What is the action of mifepristone? Options: option A hypoglycemic agent, option B antiprogestin, option C muscle relaxant, option D all of this. Action of mifepristone. Mifepristone is an analog of progesterone or norethindrone. That is, it is one of the antagonist of progestin. Okay, and it blocks the effect of natural progesterone. So here the correct answer is antiprogestin. Okay, it is one of the analog of progestin or antagonist of progestin. So antiprogestin, option B is the correct answer. Move on to the next question. Who is known as father of Indian pharmacology? Options: option A Prem Chopra, option B Sir Ramnath Chopra, option C Ronald Chopra, option D Paul Ehrlich. Father of Indian pharmacology is Sir Ramnath Chopra. Option B is the correct answer. Move on to the next question. Which of the following food enhances the absorption of an iron supplement? Options: option A bagged potatoes, option B orange juice, option C fortified milk, option D egg yolk. Question: food enhances the absorption or food increases the absorption of iron supplement is. The factors and food which increases the absorption of iron include vitamin C rich food and acid medium. Vitamin C is citric acid which contain acid medium. So acid medium enhances the iron absorption, and empty stomach also enhances the iron absorption or increases the iron absorption, and meat will also increases the absorption of iron. Here orange juice is there, it is rich of vitamin C, so that is the correct answer. Vitamin C enhances the iron absorption, and the factors or food item which decreases the absorption of iron includes alkalis, egg yolk, maize, wheat, and food in stomach, that is full stomach, that will also decreases the absorption of iron. Move on to the next question. Lansoprazole is not used in which of the following case? Options: option A gastritis, option B peptic ulcer, option C Zollinger-Ellison syndrome, option D thalamus hypertrophy. Lansoprazole or pantoprazole is proton pump inhibitor. It is used for the treatment of gastritis, peptic ulcer, Zollinger-Ellison syndrome, but not used for the treatment of thalamus hypertrophy. It is related to CNS problem. Remaining all, that is option A, B and C, all GIT, gastrointestinal tract related problem. Move on to the next question. Drug of choice in theophylline poisoning is. Options: option A cortisone, option B propranolol, option C thyroxine, option D phenytoin. Which is the drug of choice in theophylline poisoning is propranolol. Option B is the correct answer. Move on to the next question. Which among the following drug is administered sublingually for the management of angina pectoris? Options: option A aspirin, option B nitroglycerin, option C warfarin, option D atenolol. Which drug is given sublingually for the treatment of angina pectoris? It is nitroglycerin. Nitroglycerin is administered sublingually. Sublingually means keeping under the tongue. The drugs which are keeping under the tongue, which will help for fast absorption into the circulation through the blood vessels. Okay, so it will help to fast relief of pain. That is angina pectoris. Angina is a chest pain. Move on to the next question. Which of the following drug is withheld if the patient pulse rate is less than 60 beats per minute? Options: option A digoxin, option B dobutamine, option C phenytoin, option D nifedipine. The drugs which is withheld or stopped if the patient pulse rate is less than 60 is digoxin. Option A is the correct answer. Digoxin is an example of cardiac glycoside if the patient is having bradycardia. Bradycardia means decreased heart rate. If the pulse rate is below 60 means we are withholding the medicine, that is digoxin. And the therapeutic digoxin range is 0.5 to 2 nanogram per ml, and the toxic level is above 2 nanogram per ml. If the patient is having digoxin toxicity means the patient may experience hypercalcemia, hypokalemia, hypomagnesemia or hypothyroidism. Suppose if the serum potassium level is less than 3.5 milliequivalent per liter means we have to stop the digoxin because it is one of the sign of toxicity. Move on to the next question. The inotropic agent that can only be administered intravenously for heart failure is options. Option A digoxin, option B dobutamine, option C nifedipine, option D atenolol. Among this option digoxin, dobutamine, nifedipine are example of inotropic agent. Among this dobutamine can give intravenously for the treatment of heart failure. And the digoxin and nifedipine is usually given by oral route, and atenolol is not an inotropic agent. It is an example of beta blockers. Move on to the next question. The main drug of choice for heart failure is options. Option A morphine, option B digoxin, option C dobutamine, option D none of this. Which is the main drug of choice for heart failure? It is digoxin. Option B is the correct answer. And move on to the next question. A client is taking lithium carbonate, reporting vomiting, abdominal pain, diarrhea, blurred vision, tinnitus and tremors. The lithium level is 2.5 milliequivalent per liter. The nurse interpret this level as options. Option A toxic, option B normal, option C slightly above normal, option D excessively below normal. Here the question, a patient is on lithium carbonate treatment and complaints of vomiting, abdominal pain, diarrhea, blurred vision, tinnitus and tremors. So here the patient serum lithium level is 2.5 milliequivalent per liter. So it indicates what? That is the question. Normal therapeutic serum lithium level is 0.6 to 1.2 milliequivalent per liter. And toxicity begins when the serum lithium level is above 1.2 milliequivalent per liter. Here mild toxic means serum lithium level is 1.5 milliequivalent per liter. Moderate toxicity means 1.5 to 2.5 milliequivalent per liter, and severe toxicity means greater than 2.5 milliequivalent per liter. Here in our option, the lithium level is 2.5 milliequivalent per liter. So it is toxic. In our option, toxic is there, normal is there, slightly above normal, excessively below normal. So it is toxic level. Option A is the correct answer. Friends, today again we discuss questions from pharmacology. Surely these points and important questions will helpful for your studies. If it is useful for your studies, please share my videos to your friend circle. And if any suggestion, please comment in the comment box. I'll improve myself for explaining the questions and points.